हेलो स्टूडेंट्स, आज हम रिकॉल करेंगे FMT PYQ INICET 2022। फर्स्ट क्वेश्चन है, सागर was being tried in a court for the murder of Mohan in the park. Shikhar appeared in court and said he saw Sagar carrying a knife in his hand while in park. What is this evidence known as? A direct, B indirect, C hostile, D hearsay. इसका आंसर है B indirect। इसका एक्सप्लेनेशन है ये, this evidence is known as indirect evidence. Indirect evidence is also known as circumstantial evidence. It is not the direct testimony of an eyewitness. It has an effect on their fact and subsidiary facts which are dependent upon as consistent. Second question, fingerprint first developed in how many weeks of intrauterine life? A 12 to 16, B 20 to 24, C 28 to 32, D 32 to 36. इसका आंसर है A 12 to 16. Fingerprint first develops in 12 to 16 weeks of intrauterine life. It is complete by 24 weeks. Question number third. Identify the given plant. A. Datura alba, B. Argemone mexicana, C. Nerium odorum, D. Papaver somniferum. इसका आंसर है B. Argemone mexicana. The given plant is Argemone mexicana. The flowers are yellow in color. All part of the plant are poisonous. Oil extracted from argemone seeds is commonly used as an adulterant is mustard oil. Sanguinarine and dihydrosanguinarine are the toxic alkaloids present in the oil, and it causes epidemic dropsy. Epidemic dropsy is characterized by vomiting, diarrhea, edema of the feet, and generalized anasarca. Some patients may develop hypersecretory glaucoma. It can cause to death due to cardiac failure. Question number 4. A male patient was presented with a history of consumption of an unknown substance. He had increased sweating, lacrimation, diarrhea, muscle weakness, and bradycardia. What is the management? A. Atropine, B. Calcium gluconate, C. Pralidoxim, B. Obidoxim. इसका आंसर है A. Atropine. The clinical scenario is suggestive of organophosphate consumption, and atropine is used for its management. Atropine is a muscarinic receptor antagonist, and it competitively blocks the acetylcholine and muscarinic receptors. Organophosphates are powerful acetylcholinesterase inhibitor. It is absorbed by inhalation or through the skin. Mucous membranes and the gastrointestinal tract are also the sites for absorption. The predominant initial signs are of muscarinic excess, which includes dumbbells. इसका न्यूमोनिक है dumbbells. Diarrhea, urination, meiosis, bronchospasm, bradycardia, emesis, lacrimation, salivation, and sweating. Question number 5. Which of the following is not a feature of cocaine intoxication? A. Tingling and numbness of hand and feet. B. Constricted pupils and bradycardia. C. Hypertension. D. Hyperthermia. इसका करेक्ट आंसर है B. Constricted pupils and bradycardia. Constricted pupils and bradycardia are not a feature of cocaine intoxication. Dilated pupils and rapid pulse are seen in cocaine intoxication. Cocaine is obtained from the leaves of Erythroxylum coca. Cocaine can be administered by snorting, intravenous route, or smoking. The manifestation of cocaine intoxication occur in two stages: the stage of excitement and the stage of depression. Question number 6. Postmortem examination of a patient reveals the following. What is the finding known as? A. Hesitation cuts, B. Grazed abrasion, C. Laceration, D. Patterned bruise. The correct answer is A. Hesitation cut. The finding is known as hesitation cut. It is a feature of suicide. They are small multiple cuts which involve only the superficial skin. They are seen at the beginning of the incised wound. The throat, wrist, and front of the chest are the common sites. Unintentional cuts are seen on the fingers in which the razor blade are held. Question number 7. Poisoning with which of the following agents would cause hypertension? A. Organophosphorus, B. Paracetamol, C. Arsenic, D. Cocaine. इसका आंसर है D. Cocaine. Poisoning with cocaine cause hypertension. This is due to the inhibition of norepinephrine at the adrenergic terminals, leading to increased sympathetic stimulation. This effect occurs at all concentration of cocaine and causes hypertension and ventricular ectopy. Cocaine is obtained from the plant Erythrosallum coca. Question number 8. Treatment of choice for acute arsenic poisoning is ipecac, B. Penicillamine, C. Activated charcoal, D. Dimercaprol. इसका आंसर है D. Dimercaprol. Dimercaprol is the treatment of choice for acute arsenic poisoning. Arsenic is an odorless, tasteless, metallic poison. GI features of acute arsenic poisoning include nausea and vomiting, colicky abdomen pain, and profuse diarrhea with rice water stools. In chronic arsenic poisoning, skin symptoms include erythematous lesion and flushing, and can also lead to hyperkeratotic skin and desquamation. Pigmentation is patchy and resembles raindrops on a dusty road. In the distal parts of the body, hyperkeratosis is present. Mesalines are transverse white striae of the fingernails called striae leuconcia. Renal manifestations include chronic nephritis and urine contain albumin, cast, etc. Arsenic can be detected in the bones for prolonged period. Hence, it can be found even in skeletonized remains of the body. Question number 9. To detect vaginal cell on a person who is accused of rape, which test will you use? Fluorescence, B. Barbario, C. Lugol's, D. Precipitin. इसका आंसर है C. Lugol's. Lugol's iodine test will be used to detect the vaginal cells present on the penis of a rape accused. It shows brown color on filter paper due to presence of glycogen in epithelial cells of the vagina. Question number 10. Which of these is not a cardiac poison? A. Aconite, B. Cerebra thievetia, C. Nicotiana tabacum, D. Atropa belladonna. इसका आंसर है D. Atropa belladonna. Atropa belladonna is a deliriant poison that acts by inhibiting the muscarinic effect of the acetylcholine. All the parts of the plants are toxic. The active principle is 1-hyoscyamine. Clinical manifestation of belladonna poisoning: fever, flushing, rash. Neurological symptoms: delirium, slurred speech, headache, choreoathetosis, myoclonus, visual and auditory hallucinations, convulsion and coma. Eye symptoms: photophobia, blurred vision, dilated pupil, poorly reactive to light. Cardiovascular symptom: arrhythmia, tachycardia, hypertension. GI symptoms: severely dry mouth and throat, decreased bowel sounds, constipation, ileus. Renal symptoms: urinary retention. Anticholinergic symptoms include tachycardia, hypertension, flushing, dry mouth, mydriasis, and urinary retention. Question number 11. The image given below is a type of A. Contusion, B. Abrasion, C. Laceration, D. Stab wound. Answer A. Contusion. The type of injury shown in the image is a contusion. A contusion is characterized by the infiltration of extravasated blood into the subcutaneous and/or subepithelial tissues. It results from the rupture of small blood vessels due to the application of blunt forces. A pure bruise lies beneath an intact epidermis. Bruises are caused by damage to veins, venules, and small arteries. The usual bruise from a blunt impact is situated in the subcutaneous tissue, often in the fat layer. Because of the greater volume of soft subcutaneous tissue in fat people, they tend to bruise more easily than thin ones. Delayed bruising: it is common knowledge among lay persons as well as doctors that a bruise may come out that is become more prominent with the passage of hours or days. This is partly caused by continued bleeding from the ruptured vessels, but mainly by the percolation of free blood from its origin deeper in the tissues upward toward the epidermis. Question number 12. Spanish windlass is a type of which strangulation method? Bandsdola, B. Garroting, C. Mugging, D. Throttling. इसका आंसर है B. Garroting. Spanish windlass is an improvised version of garroting, and it involves tightening an iron collar (Spanish windlass) around the neck and forcing a spike against the neck into the spinal cord. This was a form of judicial execution once employed in Spain. The rod-like object used to tighten the ligature is also called a Spanish windlass. This may be a ruler, stick, or screwdriver. Garroting involves attacking the victim from behind. Question number 13. A person of Ionism derives pleasure from A. Wearing clothes of opposite sex. B. Kissing and licking of anus by a sexual partner. C. Underclothing of female. D. Seeing a female undressing. Answer A. Wearing clothes of opposite sex. A person of Ionism or Vestism derives pleasure from wearing clothes of the opposite sex. It is usually found in males. His dress, manner, occupational interest, and association are all designed to increase his feeling of being a woman. Question number 14. A lady underwent cholecystectomy and now she presents with abdominal pain. 1 month later, an erect abdomen X-ray was taken and the image is given below. The following offense comes under A. Novus actus interveniens, B. Res ipsa liquidator, C. Resa judicata, D. Respondeat superior. इसका आंसर है बी रेसा इप्सा locutor. The X-ray shows a pair of surgical scissors left behind in the abdomen after surgery. The offense comes under res ipsa liquidator. It is obvious evidence of the negligent act committed. Res ipsa loquitur means the thing or fact speak for itself. The negligent act is so obvious that is the patient need to prove the negligence. He has to merely state that according to him was the negligent act. The doctrine applies to both civil and criminal negligence. All of the following conditions should be fulfilled for this doctrine. In the absence of negligence, there would not have been any injury. Usually, the doctor had complete control over the injury producing instrument or treatment. The patient was not a part of contributory negligence. Question number 15. Tattooing around the entry wound of a bullet is due to A. Unburnt particle, B. Smoke, C. Flame, D. Muzzle impression. इसका correct answer है A. Unburnt particles. Tattooing around the entry wound of a bullet is due to the deposition of unburnt powder particles. These are difficult to remove. They are also called stippling or peppering. This is seen up to 50 cm of firing, when the distance between the firing and the victim is between 30 to 50 cm. In the case of pistols and revolvers, it is a near shot wound. The victim is within the range of powder deposition, so there is some amount of tattooing present, but it is outside the range of flame, so there will not be any burning or singeing. There will not be any blackening as it is outside the range of smoke as well. Question number 16. Pick the mechanism of cold water drowning. A. Asphyxia, B. Laryngeal spasm, C. Vagal inhibition, D. Cardiac arrest. इसका आंसर है C. Vagal inhibition. In cold water drowning or immersion syndrome or hydrocution, death occurs due to vagal inhibition, leading to cardiac arrest. Hydrocution or immersion syndrome refers to sudden death following immersion in cold water. Death results from vagal inhibition of the heart, that is, uh, cardiac arrest occurring due to increased stimulation of the vagus nerve. Question number 70. Identify the pattern of abrasion shown in the image below. Ligature mark, graze abrasion, pressure abrasion, or imprint abrasion. इसका आंसर है C. Pressure abrasion. The given image shows as an abrasion due to ligature mark, which is a pressure abrasion. Abrasion are superficial wound produced due to injury to the epidermis. They are usually caused by friction against a rough surface or by compression. Question number 18. Gas shadow is present in the great vessels of a fetus in the case of intrauterine demise. What is this sign called? A. Robert sign, B. Spalding sign, C. Ball sign, D. Halo sign. Answer है A. Robert sign. Gas shadow in the great vessels of a fetus in intrauterine death is called the Robert sign. It is the earliest sign and is seen within 12 hours of death. The gas shadow may be present within the chambers of the heart or in large vessels of the fetus. Question number 19. A man was brought to the emergency department with a history of assault by a mob using heavy blunt object and sharp object. On examination, crushing on of the hair bulb was seen. Identify the type of wound. A clean-cut incised wound, B lacerated wound, C chopped wound, D avulsion injury. इसका आंसर है B lacerated wound. The type of wound in which the crushing of the hair bulb is seen is a lacerated wound. Cut laceration may be produced by blunt weapons or heavy, relatively sharp-edged weapons such as axe, hatchets, and choppers. Scalp laceration can be found in association with bruising and abrasions. Facial strands, hair bulbs, nerves, and vessels that run in the depth of the wound are irregularly torn and crushed. Margins are irregular, ragged, and uneven. The ends are pointed or blunt. The edges of laceration, especially over the skull, are undermined. The depth of the wound varies according to the thickness of the soft parts at the site of the injury and the degree of force applied. Question number 20. Identify the postmortem change given in the image. A. Marbling, B. Tattooing, C. Lividity, D. Filigree burns. इसका आंसर है A. Marbling. The postmortem change shows above is marbling, which is an external sign of putrefaction. In marbling, the superficial vein of root of the limb, thighs, side of the abdomen, and shoulders are stained greenish brown or purplish red in a linear branching pattern. It is usually prominent 36 to 48 hours after death occurs due to the formation of self-hemoglobin subsequent to hemolysis of red RBCs. In putrefaction, bacteria from the gut enter into and multiply in the surrounding tissue, eventually spreading through the blood vessels to other parts of the body. The bacterium Clostridium welchii is largely responsible for the putrefactive changes spreading through the body. Due to its production of the enzyme lacethinase, the first external sign of putrefaction in a body lying outside in the air is a greenish discoloration of the skin over the region of the cecum. Question number 21. A male patient working in the matchbox industry for the past 20 years reports to the dentist with multiple sinuses and fistulae in and around his jaw with foul smelling discharge. Which of the following chemicals are responsible for this? A. Bromine, B. Antimony, C. Fluorine, D. Phosphorus. इसका आंसर है D. Phosphorus. The clinical scenario is suggestive of a phossy jaw, which occurs due to chronic phosphorus poisoning. Phossy jaw refers to osteomyelitis and necrosis of the jaw, with foul smelling pus discharging multiple sinuses. Frequent inhalation of phosphorus fumes causes necrosis of the lower jaw in the region of a decayed tooth. Patient initially present with toothache, followed by swelling of jaw, loosening of the teeth, necrosis of gums, and sequestration of the bone in the mandible, producing considerable facial disfigurement. Question number 22. Which tragedy is related to A. Phosphorus, B. Mercury, C. Ethanol, D. Methanol? इसका आंसर है D. Methanol. Which tragedy is